No. No. You guys ready to roll?
Yeah.
Okay, it's 2:00. We'll call the Community Health Board to order. And no, we don't need to do roll call. First off, we've got the approval of the agenda. Everybody got the agenda? Are they any additions, corrections, or anything for the agenda? Otherwise, I'll look for a motion to approve the agenda.
I'll make that motion, Mr. Chair.
All right, we have a motion by Commissioner Carlson. Do I hear a second? Second by Commissioner Sumner. All in favor of approving the agenda as presented, say aye. Aye. Any opposed? Motion carried 4-0. And we got the approval of the July meeting minutes, and I noticed one change in there. On the last page, page 3, it says the next regular meeting of the county board will be October 15th, 2025, but it actually should say October 21st. October 15th was the 2024 next meeting date, so we'll have to change that to October 21st, which is today, obviously, and then we'll reprint those and that. But if we can get a motion to approve the amended minutes, if there's any other changes that anybody has.
Mr. Chair, I move that we approve the amended minutes.
Thank you. Do I hear a second to that?
Second.
Second by Commissioner Winger. Any further discussion? All in favor of approving the amended minutes of the July meeting, say aye.
Aye.
Aye. Any opposed? Motion carries 4-0. Community Health Board Programs and Services update. Amy is on deck. You're on up to the podium.
That's kind of a big deal, with the World Series coming up Friday, you're on deck.
I know. Well, hopefully I hit a grand slam today for you guys.
Oh,
How's that?
wow.
That's good? Yeah. All right.
Yeah.
My second goal is to not mess up any of the names of our programs today,
You-
so.
You had the magic on opening the door, and now that's what, how are you gonna top yourself?
Well, I brought a whole team of
It
very
looks like
important
it.
people with me, so.
Yeah.
So we'll get started with our, where we've been, where we are, and where we're going. And I figured since this was our last community health board meeting of the year, it would be a perfect time for us to reflect on where we've been over the last couple years, and then where we're currently sitting and where we're headed. Do you want to just do it? Oh, good tip. There we go. So here's our team, our baker's dozen plus one. Now, if you can count, there isn't a baker's dozen plus one in here because we have 2 new additional members since this picture was taken. And so I just want to quickly introduce, during our storm event in June, we had Megan join us. There's Megan. And then in September, we had Alexa. And we had our new program manager, Jenna. So I just want to make sure that you've introduced to some new names and faces for individuals who have joined our team. So we are fully staffed and we are ready to go. That's where we're headed. So this is just to showcase how we make sure that when we're working hard every day, we also take time to do some team building and some connecting and just kind of refreshing ourselves. We also spend a lot of time learning and sharing. And so over the course of the last couple of years, we've had some really unique opportunities to spend some time across the country sharing the work that we do here locally in Beltrami County. And so in the top left-hand corner, that was when you guys sent me out to Philadelphia for the National Convention on Behavioral Health. And then the top right corner was at our state capitol at Public Health Day on the Hill. And the bottom ones are with our grant and our partnership that you guys approved with HRSA with Samford. Becky and I had the opportunity, we got caught in a rainstorm, but we had the opportunity to be out in Washington, D.C. and share about the work that we're doing with the maternal child population, NAS, and so our neonatal abstinence syndrome and improving the health care of our moms and babies. And then doing some emergency response training. The bottom picture is out in Cincinnati. We also enjoyed some firsts. So some firsts was our first not I want to say retirement, but Monica Thule left our department. So that was the first for me, having a leader leave and having to hire on a new leader. The first ever menstruation health week. One of our very own, Dina Michaels, she was a guest speaker and got to speak at an event that took place at BSU. And then, of course, our first Cha Chip. So photograph of you fine gentlemen posing for our group photos as we put our Cha Chip together. Just a little fun in the big picture is our leadership team. So that's Health and Human Services. And while we might be a community health board that funds our public health program, without everybody in that picture, we would not be able to accomplish the things we do, because that's one thing that makes our public health really unique, is that we rely on social services, rely on economic assistance, and we rely on our financial department to make our programs and our services run efficiently. And without that team, we would not be able to serve our people as well as we do. And then in the bottom corner, it's hard to see, but I would be a little sad if I didn't bring a little humor into how much I pick on Steve Shadrick, but that is me and his team telling Steve that he should make a public health director parking spot outside the garage, so I don't have to get wet when it rains. And then we're just so grateful that you guys approved our remodel. And so with the public health remodel, our space is not only improved, but our services are just instrumentally changed. We now have a community space where we can host community educations. We had a VA baby shower held there. We have a really great space for people who are doing supervisory visits, where they can come in and their kids can play, they can feed them. We've had Easter egg hunts in there with families. And so that space up in the middle corner is just been a blessing to our team and to our agency as a whole. Our WIC program has been able to really transition their services instead of doing everything in one tight space. If you're familiar with hospitals that have child life centers, it's those specialty areas where they take the child out of the room, and that child life specialist takes them into an exam room where they have their pokes and their medications, and then their room is a fun place. That's exactly the type of space that we were able to create with that remodel by just knocking down a wall and shifting where office spaces were held. So now in the middle corner, that's where our exam pieces, our health screenings are done. And then we have a space for kids to play, moms to nurse, and just kind of that more private, intimate area right off of where our WIC dietitians then do their visits. Wellness and team building. It's been a huge part of things that we've focused on over the last couple of years. And we don't just do those things with our team, we do those things with our agency. And so we just got a couple photographs to showcase some of the wellness activities that we've done. None of them resulted in injuries, just the bottom left-hand corner resulted in a quick text message to our maintenance staff, letting them know they didn't need to respond to the fire alarm going off because the public health director may have burnt the bacon.
Timer?
What's that?
Timer? The fire alarm goes off?
Yeah, then the food was done. Yes, yes. And I haven't been invited to cook again. And then the outreach and partnerships and education. This is one of my favorite things about public health, is our ability to not just do the work within our agency, but the partnerships, the friendships, and the education that we've been able to expand into our community. And so these pictures just showcase some of the new things that we've done since my tenure began here. So we attended the Pride event, Monica Thule, myself, and our emergency manager. We really built education into attending that event. People could watch our videos and take our survey, and then they would be entered into a drawing to go home. If they won, they got to take home an emergency kit bag. And so it was a backpack that had dehydrated food in it. It had multiple other items that people should have in their home in the event of an emergency. We've attended different youth events. We've done training for our agency that was actually opened up to the community. That's that top middle picture. We expanded our foot clinics by writing a partnership with a program called Souls for Souls. And so people not only get foot care and education, but now they can leave with a brand new pair of shoes and socks. And then we were the primary sponsor for the Evergreen Conference last year, which was very well attended and a pretty important event for our community for individuals that's serving the youth population. And then our big event for this year was preparing people to respond, training people to prepare and respond to emergencies. And so Chris and I partnered together and brought in the Red Cross, and we did a 2-day training for our shelter event. And so we had one day where it was classroom lecture, and then one day where we simulated actually setting up a shelter, where we had community volunteers come in. And, you know, we had families, we had people with disabilities. We tried to meet all of the needs of potential things that we may encounter when we opened up a shelter. And then we also provided AED training for the all-employee agency training this year in partnership with Steve Shadrack.
Amy,
Yeah,
that training was actually pretty timely. Wasn't that right before the storm hit?
2 months to the day.
Yeah.
Yeah, so on April 21st, Chris and I walked into the shelter or into the Sanford Center to set up for training, and 2 months to the day, I walked in with, I can't remember Dave's last name, but he was our head kind of liaison for the Red Cross. He and I walked in to set up for a real life shelter.
That was pretty awesome that you guys did
Yeah.
that training and were able to capitalize on it right away. Unfortunately, we didn't want the storm, but at least
Yeah.
you had done the training ahead of time. So great job.
Yeah,
And
thank you.
to Chris too.
Yeah, I couldn't have done it without Chris. Well, and this other team behind me, like if they wouldn't have participated, taken the training serious, that day that I called them up and said, hey, we really have to set up a shelter, and they showed up, and whether it was to show up, here at the building to keep our services running, or if it was to show up at the Sanford Center, or if it was, I had a staff, I had a flat tire and I couldn't manage a shelter and go get my tire fixed. So it took a team to figure out how to go get my flat tire fixed so I could eventually leave and go home, so it was all those kinds of things, from Bobby Anderson, firing up his grill and running out to the porta potty station. So I could probably spend a whole hour talking about just the thanks and the gratitude and all the hands on deck that it took to make that as successful as it was.
Great teamwork.
Yeah. After, in between the storm and all those events, we continued to do community events and engagement. So this is just a couple pictures to show you of some of the booths and the things that we have purchased with our funding this year to raise awareness and education in the community for the services that we provide. And then, of course,
Mr. Chair.
our favorite question,
Commissioner Sumner?
yeah,
Your last slide there.
Yeah.
I had a question about WIC, and I don't know if this is a question for you or Ann, because I know that we're going to be getting some updates in regards
Yep.
to federal funding and whatnot. Is WIC going to be part of the update, or?
I don't know if Ann is including WIC in your update. No.
Okay,
So I can just give you a real brief update on WIC, business as normal.
okay,
Yep, people are still able to use their, it's a card like an EBD card. Yep, they can still use their benefits. They can still enroll in our program. We can take new members right now. And if people have issues with their card, they can just call us and we can upload those benefits.
okay, yeah, because I had a concern. I've seen and heard chatter in the community about the potential loss of the WIC program or funding, of WIC, and I was kind of curious to know if that's true, or if it's something you're thinking about on.
We are keeping tabs on it, and we have weekly meetings with the state to get updates on where funding is at, where the program is at. And so right now, our kind of universal message across the state is business as normal week, and we can continue to enroll new members.
Okay, thank you.
Yeah,
Commissioner.
good question.
Thank you.
So one of our favorite questions as people have asked us to talk about our emergency preparedness training and our response to the storm is we like to ask the question, we were ready, are you? And because it's so important that while we can provide education and training across the community, we need to make sure that people are individually prepared also. And we need to know who our partners are. And so this is just a showcase. All the red dots on the map are all the counties that participated in our training back in April. And so that's just to showcase that that partnership is so important because our team of a baker's dozen, even Health and Human Services of 160 plus employees, we need our community partners when we're responding to emergencies and when we want to do education to prepare people. And just a couple pictures. I probably could have 5 or 6 slides, but I tried to pick out some of my favorites and to showcase all the hands that it took to make our response to the storm a success. And we even tried to have a little bit of fun with it. So one of the things that I think is pretty cool is that in the left middle picture, that's Steve Shadrack's team. So we even had help and support in the work that we did from Steve's team. And so I just think that it speaks wonders to the county employees and their willingness to step up. And it really does show our willingness as a community to partner together and to support each other. And we continued to make services flow as normally as possible. And that's what those 2 side pictures on the right are showing. And just some more of the storm and our response, our partnerships, keeping our clinic running, our post-storm resource center, and our partnership with Salvation Army. And as you would hopefully expect, we did recover. Our 3 family health techs are now officially college students at NTC. So we had to do their first day of school. When they graduate in May, they will all 3 have their community health worker certificate. And we've met with Kev and Commissioner Sumner and I. We went up to a health fair in Red Lake, and we had a party called In the Woods, where we celebrated our September birthdays. And then our WIC team did an outreach project where if you attended and did not miss your August visit, you got a nice little tote for groceries and going to the farmer's market. And to finalize, we continue to work with community partners across the state. And so just a couple weeks ago, I had the opportunity to present at our state SHAC meeting. And I've had the great opportunity to be mentored by Terrell and Dee, 2 other county commissioners across our state. And so I just wanted to showcase the importance of not only the role that you guys play, but the other commissioners across the state. They've been instrumental in advocating for the work that we do here in Beltrami County. And that is it for that piece. And I'm going to lead that into a brief presentation by Megan. One of the other updates that we wanted to give is sometimes our staff also attend our trainings, and I want her to talk about one of the trainings that she most recently attended.
Thank you. So I had the privilege of attending our NACHO, which is National Association of City and County Health Organizations meeting down in St. Paul in September. This meeting focused primarily on HIV and STI programming through public health departments. 17 rural public health departments were present at this meeting. And Beltrami County was the only county present at this meeting that does not currently have programming in place for STI and HIV prevention. We do some testing in regards to TB, syphilis, but we don't do extensive panel testing like the other counties present did. So we felt this was a really good opportunity to sit and listen to other agencies and what they're doing in their communities that look a lot like our communities. So like I said, 17 rural health departments were present at this meeting, all facing similar barriers to what we face here. Issues with transportation, facility shortages, the stigma that happens in small towns when we're facing health disparities, the anonymity, oh my gosh, that's a hard word today, of just being in a small town and what it means to access services in a small town. And then the social determinants of health that we face in the rural community as well, with not having access to those things. Some primary takeaways from this meeting that I wanted to share with you guys are that we tend in our rural communities to think that things that affect the rest of the world and larger communities aren't affecting us here in rural Beltrami County. And so bringing all of these other rural departments together really showcased to us that we are all facing the same issues. And so figuring out how to navigate that appropriately in our communities is still really important. So I got to hear from these other communities that have these programs in place, what is working for rural people versus what is working in big cities. And that was really cool to hear. And hearing that just because we don't see things every day doesn't mean that they don't exist in our communities too. So we discussed that HIV rates and rates of syphilis are still growing even in rural communities. And that's a concern for a program like ours because we focus really heavily on maternal child health. And we're seeing increases in those diseases in women, heterosexual women, which we didn't really see before. And so then we're increasing risks related to health in our children. And we want to do what we can to get ahead of that before we see that risk increase any further. We're also talked really heavily about being in maternal health care deserts. We're really lucky in Beltrami County to have a community partner in Sanford, where we do still have a pretty good OB unit. But people we know are traveling into Bemidji every single day to access maternal care, and rural hospitals are shutting down all over the state. So we might be lucky here, but that is something that should be at the top of our discussion as we're moving forward and making sure that we're giving care to those who need it. The other, and one of the most important things discussed was how some of these rural healthcare programs are giving services that differs from how we give services here. So in Bemidji, any of our services besides our home visiting program are primarily people coming into our public health office to get the services they need. And that can be a barrier for people who can't really get into our office. They don't have transportation, they don't have the gas funding. Again, that stigma of what if somebody sees me going into our public health department? It's not always an easy thing to navigate. And so the largest takeaway from this meeting for me personally was that we just need lower barrier access to healthcare. And instead of trying to change our patients, we really need to be changing the system in which we serve them. So out of 17 of the rural departments present, over half of them had mobile clinic units, which was crazy to me. I didn't know that a mobile public health unit was a thing that existed, and to know that over half of those counties had one was phenomenal. So a mobile unit is a unit that is like a miniature public health department on wheels, and they get to go out into their communities and deliver the same service that we do in office out in the communities. So at community events, going to college campuses, parking in the Lukens parking lot, and bringing care to where people are and to where it is accessible for them, was really cool to hear that communities are able to do that in areas where people just can't access.
Say, Megan, did you find out, did they get grants to do that, or how they got that funded? I mean, that's very similar to what our veterans had created their mobile unit. They got a grant for it, and actually the first one in the state to do that kind of thing for our veteran services. And can you opine on that?
Yeah, absolutely. So the main funding source that I was made aware of when asking questions of these teams was that they were using their opioid dollars to help fund these units. And that's because they were kind of reimagining service delivery as a whole and partnering with community partners and then offering complementary service delivery. So while they're using their vans to go out and do immunization clinics and WIC visits and child teen checkups, they're also using those units to go out into the community and do that HIV STI testing to offer education to people. And so by partnering with other community partners and all services provided, then they were able to utilize their opioid dollars to do so.
Commissioner Sumner, Carl?
Thank you, Mr. Chair. So Megan, my understanding is that after 2 years of our Veteran Service Office having their trailer and truck,
Mhm.
that at the end of that 2 years, we're free to do what we want with that. So hang on to that thought because they don't use it every day of the week. And I think
Yeah.
that there's an opportunity coming up in a short period of time
Very
to be
cool.
able to do double duty with that.
Very cool to hear.
Yeah.
Yeah.
Mr. Chair.
Sumner?
So, would you be able to use third-party billing to,
I might have to defer to Amy on that question. Oh, where are you?
You can do third-party billing from.
so that would be another option
Mhm.
or opportunity to utilize a mobile
Mhm.
unit. Hearing about the mobile unit, it's pretty exciting, especially for folks in my district that, that it's a long ways, to get to Bemidji and not able to readily access,
Yeah.
the fine unit we have over there. So I hope you continue to pursue, the mobile unit.
Thank you. That was pretty much all I had, just a little summary of that meeting and all the work that's being done and what I feel like could potentially come here. So, thank you. Okay.
Great, thank you.
Thanks.
So in a presentation, we use Megan as our lead-in to where we're headed. And so, yes. Yes. Megan, were you the one with the bananas? Yes. Yeah, that was Megan. Yeah, we broke her in right away. She literally had been with us for 10 days.
Oh.
Yeah, so great addition to the team. So yeah, I'm very glad to hear that the sound of a mobile unit sounds palatable because where we're headed, our CHA. So in your packet, you will find an update. The state has already reviewed our CHA chip booklet. And so I've shared that with you for the strengths and the opportunities for growth. And if you haven't had a chance to review that yet, I'm pretty excited because the opportunities for growth were made as recommendations. We have nothing to correct in our booklet, which is good because I printed 500 copies. So.
Probably gotten back to you with the spelling error.
Yeah, maybe.
Just kidding.
So that is our presentation on the first step. Any questions on where we were, where we are, and where we're headed? Okay. All right, perfect. Well, then I'm gonna give the podium to Jeremy, and he's gonna introduce himself.
Thanks, Amy. It's good to see you all. My name is Jeremy Drucker. I'm the State Director of the Office of Addiction and Recovery. This is a relatively new position. It was created in 2022 by the governor and the legislature. I'll kind of go through what it does and what it means and what we're working on here in a second, but just want to show appreciation for you all for the opportunity to present, and also just thank Amy in particular for inviting us up. And we had a great roundtable earlier with some local school superintendents and principals and local community organizations just about youth, addressing, substance use disorder in youth, prevention, treatment, recovery, all of those things. And it's just really valuable from a state perspective to hear about the great work happening with our county partners, because ultimately we all are working together to really just improve lives for Minnesotans, and the work really gets done, the boots on the ground to happen in local communities like Bemidji and Beltrami. So really appreciate the opportunity to be up here today. As I mentioned, My name is Jeremy Drucker. I'm the Director of the Office of Addiction and Recovery. This position was created in 2022 by the governor and the legislature. It was a bipartisan deal. And it really was, the goal was to look at all of the different state agencies that touch substance use disorder in some ways or another, to bring them together in what we call a sub-cabinet. So to really get state agencies to work better together to improve the lives of Minnesotans experiencing substance use disorder, their families and their communities. And we started out with 8 state agencies in the sub-cabinet. So the Departments of Human Services, Health, Corrections, Public Safety, Education, Higher Education, Minnesota Management and Budget, and then the Minnesota Interagency Council on Homelessness. And then this last legislative session, because state government looks a little different now with the breakup of DHS and also some new state entities, we added the Department of Children, Youth and Families, Direct Care and Treatment, the Office of Cannabis Management, and then the Department of Commerce, just given their role in regulating the private insurance market. But really our goal is to promote and to create a comprehensive substance use disorder continuum of care from prevention, treatment, recovery that works for Minnesotans no matter where they're at in their recovery journey. And so really bringing all of those state agencies together to really have conversations about how can we better coordinate and align our efforts to do this work is a lot of what we do. The Office of Addiction and Recovery is not a funder. We don't have grants that we distribute, but what we do is we work with our state agency partners that do manage those programs and run those programs and talk about, you know, what are better ways that we can make investments, talk about legislative changes that we might need, talk about other budget changes that they might go through. And so my office also plays a pretty significant role in advising the governor and the governor's office in terms of what legislative proposals move forward related to substance use disorder. So we're really kind of a policy-making body, less of a program running body, so to speak. Give you a sense of kind of how we're structured. So in 2022, they created the sub-cabinet of the state agencies. They created the Addiction and Recovery Director to chair that sub-cabinet. And then they also created an external advisory body, the Governor's Advisory Council on Opioid Substance Use and Addiction. Jeff Lind serves on that advisory body. We really love having Jeff on there. He brings just a really powerful county perspective, but also perspective of someone in not just greater Minnesota, but northwestern Minnesota. And he's really become a leader in that space and really helping make sure that that body is a statewide body that really is bringing the perspective of all Minnesotans, including greater Minnesota. You'll see we have the sub-cabinet there too, which includes commissioners from all these different agencies and deputy commissioners. And then how we get our work done is we bring different state agencies together to work on a problem. And so, you know, we call those either work groups or action teams, but sometimes they'll focus on unsheltered Minnesotans, so Minnesotans with substance use disorder who are homeless. Sometimes it'll focus on justice-involved individuals or Minnesotans who are formerly incarcerated or currently incarcerated, like how can we improve outcomes there? Because those things cross different agencies, the Department of Corrections and the Department of Human Services. So we really look for those interagency opportunities that we can move the needle on some of these big topics related to substance use and addiction. Some of the key state initiatives that we're working on. So writ large, one of the big things that the governor charged me with, and I'll talk a little bit about this in a couple next slides, but is really reducing overdose deaths. And so that's something that has really been a primary charge of mine. And so a lot of the key state initiatives that we're working on are focused in that area, but not all of them. They're really focused across, you know, prevention, treatment, and recovery. So you'll see that first one. That is very acronym-y, but it's the Department of Human Services, the contract by which we operate our treatment programs with the federal government is through the Medicaid program, and it's through what we call an 1115 reform waiver. So that sets out what we can bill for, what are the goals and strategies that we want to get out of our treatment system. So that is just a huge body of work that we're always constantly refining, looking at how we can improve the work that we're doing there to ensure that outcomes, that our services are more person-centered. So they're speaking to the individual, no matter where they are, their background, but also that we're getting the outcomes that taxpayers deserve and that we want to make sure we're getting, because when we get good outcomes, people flourish, they do better, and also our costs go down. And so there's a lot of incentive to continue refining that work and making sure that we're getting the most out of that program. Additionally, one of the things we're working on is what's called a reentry waiver. So this is something that is relatively new, but the federal government has recently, historically speaking, you cannot use Medicaid dollars, so federal dollars to pay for behavioral health or primary care for individuals who are in jail or in prison. The reentry waiver was an opportunity that was created by the federal government that would allow states to provide particularly behavioral health care and addiction care for individuals up to 90 days pre-release in either prison or jail. And then it would also help with reentry hence the reentry waiver, also help them re-enter into society after they have served their time. So that is something that was passed in the 2024 legislative session. My office was really a big champion of that. And so the state is working on developing that waiver. We've submitted that application to the federal government, and we've been told that they are interested in continuing to approve these waivers, and that they haven't gotten to our waiver yet, but once they do, we look forward to engaging them in conversations to actually start implementing that. But that takes a lot of work. One of the reasons we did that was because there's just a tremendous amount of evidence that shows that individuals who are incarcerated or have gone to prison, overdoses are much higher in that population. Also, many of them have a substance use disorder, and a lot of the studies out there show that when you offer support while they're incarcerated and then help them transition successfully back into society, you see tremendous public safety benefits. And so it's one of those things that's a big win-win-win for everyone. One of our biggest champions in that effort was the Minnesota Sheriff's Association. So we worked really closely with Jim Stewart and some of our county partners as well. Our counties were also big champions of that effort. And so we were able to get that across the finish line in 2024 and continue to work on that. Also, we are working on the Department of Health has what they call the Comprehensive Overdose and Morbidity Act. So that's a series of 7 different strategies that are really looked at reducing overdose deaths. And those projects, again, cover the gamut from prevention, treatment, and recovery, really looking at linkages to care and making sure that, that every community in Minnesota, no matter where they are, have the different systems in place to help folks not delay use or not start using substances early. And then if they do, they have those linkages to care to get the care that they need and then achieve and maintain momentum in their recovery going forward. I'm not going to go through each one of these because I know time is somewhat limited and I want to give a chance for you all to ask any questions you might have. But really, when the state legalized adult use cannabis a few years ago, there came some additional dollars to make sure that we were doing as much as we could to keep kids from using cannabis early. Prevention is a huge priority for my office and for the governor and for the administration. And so we worked really closely with the Department of Health to get those youth education dollars out into communities. Local public health received a chunk of dollars. We've been up here today, and we were at Red Lake yesterday and heard a lot about how individual communities are putting those dollars to really good use, providing really good connection opportunities for youth to really head off substance use down the road. Additionally, the Department of Education is working on what's called statewide health standards. So this was something that passed in a previous legislative session. And part of that was creating what are the educational standards for students to learn about substance use in schools to, again, that prevention sense to prevent early onset use. And delay that use. That process is ongoing. So we've been working with the Department of Education on those standards, and they're moving through the rulemaking process. But again, those are standards that then every community would kind of figure out how they want to implement those in the way that makes most sense to them. Finally, naloxone saturation. So one of the big things that has really helped reduce the overdose deaths in the last few years is getting naloxone, the opioid reversal drug naloxone out there. So we've been doing a lot of work at the state across many different state agencies, figuring out how we can make sure that every community gets naloxone in the quantity that they need and has the distribution networks they need to make sure that if there's an overdose, individuals, there's Narcan on hand or naloxone on hand to reverse that overdose. but even more than that, really working with our state and community partners, including counties, to think about how can we think about reversing an overdose and the administration of naloxone, not just as a one-time event that prevents a death, but that it can really be a point for positive change in an individual's life so that it can begin a recovery journey. So it's not just we've reversed the overdose and now we're just going to walk away and hopefully it doesn't happen again, but maybe it will. But really, how can that moment be a moment where you can reach someone and really try to get them to make some decisions to change their lives for the better? So that's something that we're working on quite a bit as well. And then finally, I would just mention one of my favorite projects that I'm really excited about is recovery-friendly workplaces. So one of the things that the governor charged me with was how do we create more recovery in more places? And one of the ways in which you can do that is creating what's called recovery-friendly workplaces. So these are, where do you find people? Many of us go to work. And so working with businesses to create more recovery-friendly environments so they can support employees and their families with recovery-related issues. So sometimes it's not an employee that's having an issue, but a son or a daughter. How can we make sure that they have the services and supports they need within their employer so that they can, keep their mind on their work, be healthy, care for their family, and all of those different pieces. And so we are in the process. We've created a steering committee around this. And I'm very happy to say that I had a meeting just yesterday with someone from Wells Technology, which I believe is a Bemidji area company. And they're going to have a representative on that steering committee, just doing some amazing work in that space. I would also just say with all of these initiatives and with this work in general, one of the things I appreciate the most about it and I like the most about it is just how bipartisan it is. Everyone on both sides of the aisle really engages in a really positive way. There's just a lot of shared values in really trying to make sure that we're addressing substance use disorder in a way that touches every community and works for every community. And so I've had a great relationship with Representative Dave Baker on the Opioid Epidemic Response Advisory Council and with members of both sides of the aisle. There's just a lot of commitment to addressing this issue. And so it's been really gratifying. As much as people argue about things at the state capitol a lot, this is one space where we can really come together and focus. And so that's been really a delight to work in that way. Just maybe run through some data real quick. So as I mentioned, one of the things that the governor really charged me with was working on reducing opioid-involved overdose deaths. You'll see that in 2024, overdose deaths really started to plummet. We'll be releasing these numbers officially in the next couple of weeks, but you'll see that we went from over 1,000 opioid overdose deaths in 2022 to under 700 in 2024. And that reduction in deaths happened in nearly every community in Minnesota, across every ethnic group or background. It was really an overall reduction. And so that was really interesting to see. Yeah, Commissioner.
Mr. Chair. Yeah, go ahead. Okay. Does this include fentanyl?
This includes fentanyl, yes.
In my experience, I'm seeing a lot more of those than we ever saw before in the last year plus here. So.
Yeah. Yeah, the data comes from Minnesota death certificates. And so the Department of Health reviews these every year. We have, and we can share that information with Amy and she can get it out, but we also do a monthly overdose snapshot. This is just what the trend that we're seeing. And so there might be some individual communities that are seeing some different things. But from a deaths perspective, this is just what the statewide picture looks like. And I can show from a regional standpoint, this is what it looks like from 2022 to 2024, just based on geography. And so what we are seeing is tremendous reductions across the Northland. There's some areas in central Minnesota, South Central that are about even, but overall we're seeing a pretty large reduction statewide. And this mirrors some of the national trends that we're seeing as well. Be interested to talk to you, Commissioner, about what you're seeing from an on-the-ground perspective. But these are the numbers that we're seeing at the state level.
Must go all 9 of these.
Yeah.
There's a lack in reporting somehow, or?
I mean, it could be, I can check with our folks at the Department of Health. These are based on Minnesota death certificate records that go through the local coroner and those death reports, and then those get reported up to the state. So happy to follow up. Things I was going to mention too is in terms of the partnership between the state and the county, one of the things that the state can do and that we are eager to do is collaborate with local governments on data. And so we can certainly work with Amy and her team and Jeff to bring some of our experts from the Department of Health together that really talks about how we get these numbers. But these are, like I said, from the Minnesota death certificates. Yeah, of course. And then I think, I mentioned naloxone earlier. So one of the big distribution ways that we're trying to get naloxone out there is we created what's called a naloxone portal. So this is a way, so one of the things that can sometimes stand in the way of the state getting resources to local communities quickly is our grant process and our RFP process. For a lot of program integrity reasons and other things, it's a lengthy process to get dollars out into community. And we knew that was important for when it comes to the overdose reversal drug naloxone to get it out as quickly as possible. So what we did was we created a portal that organizations that serve people who are either in recovery or come in contact with people who use drugs, tribes, other community-based organizations, law enforcement, they could just order naloxone directly from this portal without having to go through a lengthy RFP process. And so we could get that naloxone to them much quicker. So this is just from September 2023 to July 2024, but nearly 300,000 doses of naloxone were distributed through this portal to areas across Minnesota. And you'll see on that map, those were the zip codes that it was delivered to. And so I want to really make sure that folks know that that's a resource out there, particularly for our law enforcement partners and some of our other public health workers who are out there involved in this work and can share the information on how to access that portal after this. But it's become a really good tool to make sure that when I spoke about that naloxone saturation effort earlier, really making sure that that's a resource that's available everywhere and on hand when needed. This is just some data, and I see I'm getting close. So what I might do is just kind of skip through these data pieces. And these are in your packet, so feel free to follow up with any additional questions, but there's some Beltrami specific information in here as well. This was one on hospital discharge. I think you'll see for the non-fatal overdoses too. And again, we can have a follow-up question about the data, but a significant reduction from 2023 to 2024 in non-fatal overdoses as well in the area, which is something that we've been tracking. And then just going to the last slide real quick, some of the opioid epidemic key takeaways that we've sort of learned and that we've had a lot of conversations with our partners around is just that, the opioid epidemic has kind of gone in multiple waves. It started as a prescription drug epidemic with some of the unsavory marketing practices that were happening from some of the pharmaceutical companies that have resulted in the opioid settlement dollars. It then, as we kind of got our arms around that and figured out strategies to address that, it morphed into a heroin epidemic. It's now turned into, and then there was the synthetic opioids, fentanyl, for instance, and that's where we saw overdose deaths really shoot up in 2018 to 2019 when fentanyl is called what tipped the market here, where that became the dominant opioid in Minnesota. Now what we're seeing, we're almost in a fourth wave where what we're seeing is a lot of polysubstance. So you're seeing methamphetamine, cocaine, fentanyl, xylazine, different components all mixed together. And so that's one of the things that we're tracking quite a bit right now at the state level is really understanding what's in the substances that are on the street right now that people are consuming. Because oftentimes people are consuming things they don't know what's in it. They think they're buying one thing and there's really something else in it. The other thing that we're working on quite a bit is medications for opioid use disorder. We call this MOUD for short. But these are strategies that have really been proven in conjunction with behavioral and cognitive behavioral therapy to really improve outcomes for individuals with opioid use disorder. And so it's a combination. There's three main medications for opioid use disorder out there. There's methadone, there's buprenorphine, and then there's naltrexone. Buprenorphine is the most commonly prescribed one. Naltrexone, not so much, but those three, really making sure that individuals have that available to them should they want it and need it, is really one of the things that we're working on quite a bit. It's widely considered one of the reasons why opioid overdose deaths have declined over the last several years, not just in Minnesota, but nationally. And so really making sure that that's available. We know that in greater Minnesota in particular, there are what we call these MOUD deserts. And so it was really interesting to be up here and hear folks talk about mobile units. That's something we're thinking about at the state is how we can have some mobile units to fill in gaps so that people don't have to drive as far in order to get the medication they need and they can get that care closer to home. So those are one of the strategies that we're working on. And again, also thinking about MOUD and those medications for opioid use disorder in conjunction with an overdose response. So working with EMS in particular, where if they respond to an overdose, oftentimes someone comes, what the Narcan will do, the naloxone will do, will take them out of that overdose, but it will also can send them into withdrawal, which can make them very sick. And that will and the only way that they know how to not be sick is to get more opioids. So how can we, in conjunction with that overdose response, get that MOUD to them so that it quiets those cravings? And so it gives them a chance to clear their mind a little bit and make some better decisions about where they might want to go next with their life in a way that's more positive. So that's one of the areas that we're increasingly working on right now in the state. And it's also proven to improve retention and care. So people will stay connected to treatment longer if they've got those medications helping quiet those cravings. And then they can make the best decision for themselves with in conjunction with their doctor as they move forward with their treatment plan. And so that's just some of the things we're working on here. I will just pause and take any questions or comments from you all, but really just appreciate the opportunity to introduce myself and my office and to be up here with Amy and her team today and just hear about all the great things that are happening in Beltrami. So thank you very much.
Any commissioners have any questions for Jeremy? Commissioner Sumner?
I guess maybe not a question, but a comment. I was gonna ask about, what you or your office or the subcommittee, the cabinet can do to help folks that, have to travel great distances for dosing. Yeah, I often hear from my colleague Winger here, talking about, the issue with people, having to travel 2 or 3 or 4 hours, one way, a day to do dosing and how that, is, can be an inconvenience, especially for somebody that, is trying to get back on track and how that could hinder an individual from, gaining meaningful employment and things like that. And so I'm excited to hear that there are discussions about, a mobile unit, because believe it or not, we are kind of in a desert up here, you wouldn't think, but it is. And I'm hopeful that Commissioner Winger is as excited as I am about this mobile unit that we often, talk about. So thank you.
Yeah, thank you, Commissioner. And I'll make sure that you have my contact information, but if you want to email me after this too, would be happy to continue those conversations with you offline and connect you to the experts at the Department of Human Services and make sure that as we're thinking about how to do that very thing, we're in conversation with you all and your teams on what makes sense for this county.
Any other questions? All right, thank you, Jeremy. Appreciate it.
Thank you very much.
And that brings us to commissioner comments, agenda additions for next meeting. Amy, are we looking at January 20th for our next meeting? Yep. January 20th, 2026 is that sound good to the board? That'd be our second board meeting in January. right? And so we'll memorialize that. And do we need to actually have a motion for that? Not really, right? So we'll look at that. I don't know if anybody has any suggestions right now for agenda topics for that, or if we'll,
I have a feeling that, I have a feeling Amy's already got it all filled.
she probably has a general idea, yeah. Great.
Well, Mr. Chair, before we adjourn,
Mhm.
just want to say thank you to Amy and your team for everything that you've done. Getting this child trip together, all the community events that you attend on behalf of the county. It's good to see folks in the community doing the work that you're doing. And I think it's important to recognize, without these folks, I think our jobs would be a lot harder and a lot busier. So I just want to, express my appreciation. So thank you.
Thank you, Commissioner Sumner. And I think the whole board feels that way, and we appreciate your whole team, and as well as Chris and everything that you do for our community. We really appreciate it. So, anything else for the good of the order for the Community Health Board meeting? Otherwise, I'll look for a motion to adjourn. Motion by Commissioner Carlson. Do I hear a second? Second by Commissioner Winger. All in favor of adjourning, say aye. Aye. Any opposed? We're adjourned. We'll